And finally, I'm happy to introduce our speaker for today. This is Raven Albertson. She is the program director for the Utah chapter of the Alzheimer's Association, and I will let her take it over from here. So thank you, Raven.
Thank you so much for having me here today. I'm excited to share some information with you from the Alzheimer's Association, as well as some of the collaborative partners who have some great tips, especially here locally in Utah. I have been the program director for the Utah chapter of the Alzheimer's Association for about 5.5 years. And in that time, I've, gotten to see a lot of people calling in and asking us for help with caregiving for folks living with dementia. And I want to share with you some of the things that the Alzheimer's Association has put together to address some of those concerns, specifically today with managing money. So I'll be sharing with you from our program called Managing Money, A Caregiver's Guide to Finances. And this is just some selections from this program, along with some supplemental information. If you do want to learn more about this program, I'll be sharing the link to register for the full course. But this course is designed really to help you create a financial plan. It includes activities. It has a guide that has all of the slides as well as handouts. And it's really designed for people who are providing care for someone living with Alzheimer's or, another dementia or any chronic illness. So very, very invaluable information that we all need. If you do want to access that full course, you can scan this code, or if Beth can pop that link in the chat, you can register for this on our new education center, which has all of our courses, both for caregivers, for people living with dementia, as well as other professionals in the community. So it's a great resource if you want to check out the education website, even if you're not interested in taking the full course at this time. I do want to just also give a shout out to those who put this program together. This is an evidence-based course that I'll be pulling from today, and it was really, put together to address legal, financial, care, and medical issues, but it's general information. So it is not meant to take the place of any professional advice, and we really encourage you to consult a legal, financial, and also medical professionals before you act on any of the information as well. For this course, we have some learning objectives, and I'll be focusing on about 2 of these more specifically, but I wanted to give you the overview of the course. So we want to understand, of course, how caregiving affects finances, and then kind of going through legal and financial documents that caregivers should be putting in place, how to prepare for useful discussions about financial decisions and planning, and identifying the steps to lower the chances of financial abuse and fraud, beginning to create a backup plan in case you can no longer provide care as well. So we will focus in today on kind of getting that financial plan and how to get ready to have that discussion today to start executing all of these steps. So in this program, you're going to hear a few keywords and phrases. The word caregiver describes a family member, a friend, or a legal guardian who can be supporting someone with their health and well-being. So caregiving can include a lot of different types of assistance, including activities of daily living, like bathing and dressing, as well as things like helping to pay bills, doing the shopping, managing money. So this can look really different for everybody. Some of you may also hear prefer the term care partner, which is often used to describe someone who supports a person living with Alzheimer's or other dementias in the early stage of the disease, when the person might be able to do most daily activities with little or no help. For example, they might still be paying their own bills or taking care of money, but they can still benefit from the help of family and friends. So wherever you identify your role, we want you to understand that you're providing care, even if it's not full-time care. And in this role, to understand how it's impacting you and your finances, as well as the person living with the disease. It's really important, as well to try to get ahead of it as much as you can. The word finances refers to money and things that are worth money. So this can include household cash flow, bank accounts, credit cards, loans, insurance policies, or retirement plans. Um, and financial literacy means understanding how to manage money, such as handling day-to-day expenses, how to plan for the future, decisions about money. So that's kind of the baseline that we're working from today. Sorry, I forgot that I had this. So the costs of caregiving, we want to start here. So our financial decisions and actions can have a similar impact from any other big thing in our lives when it comes to dealing with dementia or caring for somebody living with a disease like dementia or other chronic illnesses. We need to be mindful of a lot of things, and they can really take its toll. So let's look ahead and see some of these ways. Caregiving and managing financial challenges can have a major impact on the caregiver's own health due to high levels of burden, exhaustion, and uncertainty and stress. Caregivers may put off taking care of their own needs by skipping medical appointments, not getting enough sleep, or ignoring symptoms of physical and mental health conditions for themselves. Now, when caregivers don't take care of themselves, their own health can get worse, leading to additional medical expenses. So it's important to think about the impact on our own health as we're making these decisions, and maybe it helps to motivate us of why we want to have these hard conversations and maybe get organized and get this all in order with finances. So let's hear from a caregiver on what they have to say about their experience.
So some of the sacrifices I've had to make financially due to having
It's frozen for me. Sorry about that. Let me try one more
Yeah,
time.
it's frozen for us too.
Technology.
So some of the sacrifices I've had to make financially.
I apologize about that. It's really frozen. So let's
Do you want
Due to
me,
having to care
Raven, do
for
you want
my
me to try
mom,
it one time from my
or
side to
things
see if
like
we can
that.
get it? Do you want me to try to share my slides and see if it comes off? Okay.
why don't we move forward?
Okay. Do you have any more
Thank you.
videos?
Yes, we have, I think, one or two more.
Okay.
Do you think we should
I'll
switch?
cue one up while you're talking, like you
Okay.
move ahead and then I'll cue it up and see if it works on my end.
Okay, great. Thank you. Sorry about that, guys. But I think it's just really important to hear people's stories, and it helps us to connect and kind of hear, what was their experience. So if you think about your own experience so far as a support person, how that's starting to impact you and the person that you're caring for, it's important to spend a moment being mindful of that, I think. And when we hear other people's stories, it might help us to relate and resonate and think like, oh, I wasn't even thinking about that. So if you aren't attending a support group or other place where you can discuss with other caregivers, that can be a good place to start kind of practicing that mindfulness and seeing, you know what, maybe I wasn't paying attention to how much this is impacting me in the situation. So the next part of the presentation is on how Alzheimer's disease affects finances. So every illness brings different medical, emotional, and financial challenges. This is, of course, for the caregiver as well as for the person living with the disease. But caring for a person living with Alzheimer's or another dementia can be especially expensive. So let's do a little bit of detail on that. Now, with Alzheimer's disease progression, it can go from 8 to 20 years. An individual with Alzheimer's usually lives 4 to 8 years after their diagnosis, and it progresses very slowly in 3 stages. Early, middle, and late stage. And in a medical setting, these are sometimes referred to as mild, moderate, and severe. So the symptoms of Alzheimer's worsen over time, although the rate at which the disease progresses varies. But as I mentioned, there's an average of 4 to 8 years once the diagnosis is given. But some people live 20 years or more, and it depends on many factors. So we really don't have an answer of why that happens. But as that person advances through the disease and their care needs increase, so does the cost of providing care. So it's really difficult, as you can see, to get our heads wrapped around how much is this going to cost and when are those expenses going to happen, mostly in the late stages. But there's a lot to think about because it can really go for much longer than other caregiving. People living with younger onset Alzheimer's and their caregivers face additional financial challenges. So someone with younger onset needs, say, got their diagnosis earlier in life. Typical onset is 65, age 65 or later. So many of these individuals report losing or quitting one or more jobs prior to their diagnosis because their cognitive changes affected them at work. So this would, of course, be another game changer, thinking about this happening earlier in life, and really not being able to maximize on a lot of benefits from the employer, such as disability insurance, FMLA, protections, or potentially continued healthcare coverage. So there's a lot to think about if you're facing younger onset as well. We also wanted to mention that the care partners still having children at home are facing increasing costs already with their family situation. So a lot to think about preparing for a situation with younger onset. Also, just wanted to mention there's a 2-year waiting period between when a person is placed on Social Security Disability Insurance or SSDI and when they're eligible for Medicare. So in the meantime, the person living with younger onset Alzheimer's has to secure other health insurance coverage. So just thinking about the impact that can have on the entire family's insurance coverage. Another group of caregivers who face additional challenges are members of the LGBTQ community. They're more likely to be single, live alone, and are less likely to have children. This might mean that these individuals have a smaller support network and presenting more difficulties. So we want to also make sure that we're reaching those parts of this community as they may have less family support. And people from low-income households are also less likely to be financially prepared for the cost of caregiving. There might be other issues like unemployment, having part-time or low-paying jobs, struggling to make ends meet already and having limited financial resources, and then adding this on top of it, of course, adds such financial strain that relying on credit cards can start to be a habit, taking out loans, causing increased debt and poverty. And so if you know folks that are in this situation, just getting them connected with financial planning for living or caring for dementia is so important. Okay, Beth, how did it go with setting up the slides on your end?
It totally works. So let me switch to my screen and let's get it going.
Perfect, thank you.
Hopefully it'll stay working.
So when we finally moved him into assisted living, when we first got the cost, it was going to be $1,000 a month. When we started adding.
Is it not working for you guys?
I'm good now.
You're good? Okay.
Yep.
So when we finally moved him into assisted living, daily medications and housekeeping and all the other things that come with it, we were quickly at $6,000 per month. In my mind, every month I was, doing the calculations of, all right, how much money does Dad have left? How long can this last? What happens when that goes away?
Okay, I will switch the screen share back to you in just a second. Sec.
Okay.
Sorry, it's being temperamental for me as well. Why don't you just try sharing your screen again, Raven? I think it'll work. I think it'll switch back to yours automatically.
I just did. Did it work, guys?
Perfect. Yeah, I think so. I'm just my screen is funny right now. Thank you.
Sorry about that. Thanks so much. So yeah, again, just connecting with others. This is so much nuance, and so it's important to connect with others that are going through it. Start to think through the challenges that you're facing with finances as it kind of progresses. So now let's talk about what you can do to avoid or reduce the financial strains of caregiving. Now, there are benefits to putting financial plans in place as soon as possible for both the person receiving care and for the caregiver. The benefits for the caregiver can include things like knowing the person's wishes, feeling more confident in making important decisions when the person you're caring for can no longer make them, knowing how to handle financial issues and pay for care, and less chance of making costly or unwise decisions, such as taking money from life insurance, stopping insurance premium payments, or cashing in a 401k or other retirement account early. So this is just some more motivation for you of why we want you to get this started as soon as possible. And I think I just also want to emphasize, sometimes changes happen quickly. You might not be thinking about other changes that can happen, like what if a car stops running, or what if there's other unexpected medical bills or expenses that also get thrown into the mix. And if you're already kind of close to the edge there, you might feel pressure to make some of these decisions. And so starting this planning early really can help across the board with your whole situation. The benefits of early planning for the individual living with dementia include the ability to share exactly what they want to happen and help make those decisions about their finances and future care. This can be really important as we're trying to maintain, independence as much as we can for that person and have their voice guide the decisions that are made. And it also can give you a peace of mind as well, knowing that we're doing what we know that they want. And so it gives us a sense of reassurance as well as because others know their wishes and will follow them. So peace of mind for everybody. A feeling of relief also comes from having legal and financial plans in place. You won't have to worry about it. It's done. I do have another video. Oh, it doesn't want to
Are you
work.
guys able to see it okay?
It's frozen again. I'm sorry, guys.
Putting financial plans in place for care.
Sorry, did you say it froze again?
Maybe you could just play the audio.
Okay. No, let's see.
Caregivers is simply peace of mind. Oftentimes we have a lot of anxiety and fear about the unknown. How long is the disease going to last? What are the care needs going to be? When we think of all of those things that we might be apprehensive about, and we put plans in place for if this happens, here's how we'll handle it. And we really think through, here's what's typical with the disease, here's what I need to be thinking about, and here's my plan for that. It can be such a gift to the whole family because people can settle in and focus on, here's what I need to focus on today, here's what I need to think about right now, without the weight of the what ifs hanging over their head.
Thanks, Beth. So yeah, so much peace of mind can come from making these financial and legal plans and getting them in place. Sorry, a little bit frozen again. I think it just does that around the video, so now we know. So now that you know also why financial planning is important, you're ready to learn more about how to start the financial planning process. So we're going to dig in a little bit deeper. So in order to get started, you're going to need to start having conversations about money with the person for whom you're providing care. So know that even people who are comfortable managing their own money may find it difficult to discuss someone else's finances. There might be unique and nuanced challenges that you're going to face as you take these steps forward. So talking about money can make people feel really anxious or uncomfortable. It may be hard to know how to start these conversations, but there are some things you can do to make them more positive and productive. So here's some tips on that. So starting a discussion about finances, we want you to feel more confident when starting this discussion. So, and order to get to that moment of confidence, it can be helpful to do some of these things. Start by writing down your goals and what financial documents you'll want to review or discuss. So just go ahead and do an inventory and of all the things that might need to be addressed. Also include which family members or close friends should be a part of that conversation for financial planning. These should be individuals that the person is living with, or other people that they trust, people that they know, who know about their medical and financial situation. So anyone that kind of has a role that makes sense when it comes to financial planning. And then have that discussion at a calm time of day and in a quiet place. This can lower stress or anxiety for everybody in that conversation, especially the person living with Alzheimer's disease or another dementia. So we want to encourage the person to be honest about their assets and expenses, as well as what's important to them. And finally, don't rush. This can take time. So really focus on the easy wins first and build from those successes. So if this is the first time you're having the conversation and it's not going the way that you were hoping it would go, give yourself and everyone else some grace, and let's modify the goal for the day and see what could we accomplish today and take these steps forward. And then have some more conversations, and keep towing the line, really. We are going to help you get organized as well with how you can get, we have some activity sheets to share with you. So if Beth, you can share the link to those. They have a guide on starting the conversation. And then there's also some tools in there for continuing to get your financial plan in place and making these steps. So the first thing we're going to get into, and I'm just checking to see, yeah, looks like we've got the guide pulled up. If you can click on that link in the chat. So the first one is planning for the conversation is the first part, and you can actually start filling out that worksheet if you're looking at it. It's some of the stuff that I just went over. So this slide correlates with the beginning of that activity guide to help you start planning out the conversation. And then we're going to move into some of these conversation starters. So when starting the conversation, it can really help to begin with a positive statement. Finances can be really stressful, so building confidence and connection with the person you're caring for can be crucial as you kind of dip your toe in the water for that. So here's some examples, and of course you want to make it your own. Maybe I've always admired the way you've handled your finances. I really want to learn more about what works well for you. I think that especially when it's somebody who's been in charge of these decisions for their household, acknowledging that they've done that work and had that responsibility can go a long way. Also really validating their feelings, of course, can go a long way as well. So validating and kind of noticing and hearing them. So I've noticed you seem worried about finances these days. Like, what worries you the most? What can I do to help? Can really help them feel heard and help them kind of start to express themselves. And I think when you get someone expressing themselves authentically, then it's going to be a better conversation and you can get into some of this other stuff that's more business. So it doesn't need to necessarily start so formally, but really helping someone feel seen and heard. Respect is another part that you can instill. So here's an example. I respect your privacy, but it would give me peace of mind to know if you have financial plans in place so I can follow your wishes. Just kind of starting it, focus on them, focus on their tone and how they can feel like they're the one leading this out. So you might take a moment right now and write down what you might say to start the conversation. I'm just going to pause here for a moment if anyone would like to share, or if anyone has a comment or a question as you're kind of thinking this through. How would this conversation look for you?
If anybody wants to share in the chat, we can repost it for the activity if you'd like.
Hey, well, hopefully it got you thinking about where you want to go next on that activity sheet. So if you're starting a conversation about your own financial wishes for the future, here's some things that you could say if you're the person who's being supported. So you might say, I want to talk with you about my finances so that you can access them in case of an emergency. Or I really want you to understand my wishes for the future. Let's talk about how I want my finances to be managed. In your handouts, we've included a worksheet, as I mentioned, so that you can use that to plan the conversation. So you can look at that as you're continuing to think about what you want this conversation to look like, depending on which angle you're coming from. So this worksheet will really walk you through the steps that I just described, including your goals for the conversation, the financial documents you'll want to review or discuss, the people who should be involved in the conversation, and the best time and place to talk. So, we're short on time today. So again, I encourage you to take this tool and use it. And of course, we're here for you if you want to connect with us on the full course as well. And you could have a live session where we can do a little more workshopping. But in this moment, I might take a few minutes to write down on the next page, what you might say, or on that page of the activities, just to say what you might be thinking about, how you might start that conversation. But just remember, there's really no perfect way to start, but the goal is to get started. So if you're the person that's like me and you're thinking like, I don't know how to start, just start and be kind. And try to acknowledge the person that you're talking to as much as possible. So give yourself some grace and think about this, but don't get caught up in perfectionism. You might use some of these conversation starters, like I mentioned before, and think about which one felt most natural, and then what you might say next. So don't feel bad about also planning out a conversation. This might be very stressful, so it might help to have some of those things that you can look at and hold in your hand. If things get difficult, you might use them as a tool for redirection, just to stay focused on the direction that you're trying to go. So here's some more tips for positive conversations about financial planning with a person living with dementia. Number one is be patient. Give the person time to process and respond. So remember that this conversation might take some time, and plan for that. Another thing to think about is focusing on support rather than coming off as like, I want to take control over these decisions. Just make it sound more like support, and hopefully that's the approach that you are taking too. But that you understand that for yourself and them, that this isn't about control, it's really about understanding. Keep it simple, using calm and clear language, and avoid overwhelming details. So when you're planning out the conversation, when you're maybe making lists of all these different accounts and bills and things, then simplify that when you're using it in conversation. You don't need to go through every single detail. And start small. You don't have to solve everything in one conversation. So maybe what would make sense, you might, after you have used that tool to plan it all out, you might organize it into different conversation stepping stools. And so you might say, like, let's do these 3 things and the first time we talk, and just stop so that nobody gets overwhelmed. Speaking of getting overwhelmed, plan on taking breaks. Pause and revisit the conversation if emotions start to rise. It's okay. We can just say, you know what, I hear you. I can hear that, this is an upsetting topic, or this is really stressful. Like, why don't we take a break and get a snack or go for a walk, or whatever would be supported in that moment. And then always end positively. Really remember to give thanks, expressing thanks for their being open, and reminding them that they're supported, and the reason that we're doing this is because we care and want you to have, the best situation possible. And just acknowledging that it takes work to have these conversations and that we see them. So that's one tool that I wanted to share with you. There are other tools in that activity guide. So once you click on that, you'll see that the next part is on avoiding financial abuse and fraud. And there's a list of steps that you can take there as well. We're not going to go through every tool today, but I wanted you to have that. So we will go over some more basic information with the rest of today's presentation. However, now you have that tool in your hand, and it has a lot of great markers on it, like steps to reduce the risk of financial abuse and fraud are literally listed right on the page, and you can go through one by one and check them off. So let's go and move into that topic, shall we? We're going to talk about this as it can have major impact on finances for older adults, especially for those living with dementia. And, you know, there's a lot of risk for fraud and scams on older folks. And we just want to make sure that we're informed so that we can protect there. So here's a little knowledge check. On average, how much money do you think Americans age 80 and older lose each year as a result of financial abuse, fraud, and scams? And you can pop it in the chat if you have a guess, or you can shout it out. I'll just pick one. So studies show that financial exploitation is the most common form of elder abuse, and yet only a small fraction of these incidents are reported. So on average, people lose about $39,200, which is a pretty significant, sizable size of money to lose. And a lot of times that's not, they're not able to get it back. So why this is so important, and it also reminds me too, to find out, you know, if the person that we're caring for might have Alzheimer's disease or another dementia, because we know that once they are dealing with dementia, there is one of the symptoms of that can be impaired judgment and also changes in thinking and behavior. And so really it can put them at higher risk for financial abuse. So the abuse can occur anywhere. It can happen at home. It can happen in care settings. Most states have laws that make elder financial abuse a crime, so it is reportable. People living with dementia are especially at high risk of becoming a victim of fraud and financial abuse, as I mentioned, because of those changes in judgment and behavior and mood, but also because they may not remember or report the abuse, or they may not understand that someone is taking advantage of them. So as memory and other thinking skills decline, they may struggle to make good financial decisions, making them more vulnerable to scams and fraud. So even more important for us to make sure that we're in that position to be an advocate and a protector, and just getting this organized puts us in that position to do so. So if Beth, you don't mind sharing your audio again on this video.
They have
One sec. It's not letting me rewind it. 1 minute. There we go.
people living with dementia are more susceptible perhaps to fraud and financial abuse than other people because they have a disease that's attacking their brain. And so their ability to solve problems, to think about things logically, to have insight may be impaired, and they may be able to be tricked by people they trust or people who seem nice or seem trustworthy in a way that they wouldn't have been at an earlier time.
Thank you, Beth. So if there are concerns related to financial abuse, scams, or exploitation, Adult Protective Services, also known as APS, can be an important support resource. APS helps to support vulnerable adults who may be experiencing abuse, neglect, or financial exploitation. And I think that we'll probably be sharing the contact info for that. But also just a plug, I think that there's an elder abuse conference coming up in June. In the state of Utah as well. So if you're more interested in that topic, you can continue to learn there. Sorry, every time we do the video, it takes a lot longer to advance. Okay. So that's a little bit on that. And just to give you real quick before we move on, I just want to list some of the things that are on that tool that I gave you. So some of those steps include agreeing to a spending limit on your credit cards, creating separate accounts potentially, signing up for a free credit monitoring service can be a great idea. Consolidating bank accounts and credit cards or canceling those that are unnecessary. Signing up for electronic bank and credit card statements, just so you can keep an eye out for unusual purchases or changes, charges, all of it. Asking credit card companies to stop sending balance transfer checks is also a great idea. And then you might set up auto pay for bills using direct deposit, and then set up your automatic notifications. So you could actually get notifications to your phone or text and different things to get notified when anything happens. And that way you can really monitor more effectively. Other ideas like storing financial documents in a locked file cabinet. I've heard stories where the person living with dementia actually got into files and actually destroyed them, whether they've been shredded or otherwise disposed of. So I've had personal experience of that being a good idea. And then also, shredding those that are more than a year old so that you don't need to worry yourself with any of that. You might also sign up for the do not call list on donotcall.gov as well. Just some tips before we move on. So this part that I'll share with you now is on identifying financial and legal needs. So many caregivers avoid or delay making financial and legal plans. It can really feel stressful to think about the future, especially when you're caring for someone with a chronic illness. So it might be at the bottom of your list. Jobs, family responsibilities, and other duties can make it hard to find the time to organize financial and legal matters for yourself or someone else. But as we've discussed, it's so important to put these plans in place as early as possible. And you can make the process easier by breaking things into simple steps, doing one task at a time. So, I'm not sure what is going on with this block here. Sorry about that. So there are some documents that you want to have. You want to be able to look at income and spending, take an inventory of assets and debts, identify the costs of care, and make arrangements for ongoing financial responsibilities. These documents can often be found through attorneys, financial institutions, healthcare providers, or secure home filing systems. And it can also help to create a centralized folder or checklist for important paperwork. So let's look at the next part of the tool that I shared with you is under covering care costs. So on that one, it has you go through and list income, list expenses, and then you'll basically do a budget on this page. Just looking at, it's just a worksheet to help you get started. So like I mentioned, a lot of people are going through a lot of stress when they're making these plans. So having these tools can really help you move forward. Oh, there it is. It was just too many steps on the page. Sorry about that. So of course you want to take inventory of assets as well, anything that has value, and then any debt that exists as well. You want to look at also identifying the costs of care. So as I mentioned, we don't know how many years you might be caring for somebody living with Alzheimer's disease or another dementia. But knowing that as someone enters the late stage, that it's going to cost more. And so start to think that through: ongoing medical treatment, prescription drugs, personal care supplies, adult day services, in-home care services, full-time residential care services. So all of this, again, is on that worksheet where you can start to plan that out and kind of think it through. Think about, what is this how can we make these plans? How can we reduce expenses as much as possible? But also that starts again with being mindful. We really just need to start by taking that inventory and getting organized. So maybe let yourself off the hook. The first step as you're working on, this inventory and kind of identifying all of it. And just that's what you do that day. And then the next step, do it when you feel like you have the capacity again to give some energy here. So that next step might look like making arrangements for those ongoing financial responsibilities, paying bills, arranging for benefit claims, making investment decisions, preparing tax returns are all things that you're going to be responsible for, and something to start kind of getting your head wrapped around it. Again, thinking as you're having that conversation, maybe asking about their preferences for investments, maybe asking about their preferences for the beneficiaries and things like that on their legal paperwork, on their financial investments and such. So as you're getting organized, it can also inform those conversations even more. So also it can be helpful to look into financial resources that can cover the cost of care. Some common funding and resources include personal resources like their income, 401k, or other retirement accounts. They may have savings, stocks, bonds, and personal property. You can also look into federal funding such as Medicare Parts A, B, and D, veterans benefits, Social Security, disability insurance, the Compassionate Allowance Initiative. There's also state resources like Medigap and Medicaid, and you can find additional resources at benefitscheckup.org. That's benefitscheckup.org, and that's there on the slide as well. So in your handouts, in your activity guide, there actually isn't a list for this, but there is on our helpline. We can actually call and give you some more resources about common funding sources. So call the Alzheimer's Association at our 24/7 helpline at 800-272-3900. And they're happy to talk with you and work through common funding sources, as well as all the other things in this presentation to help you take those next steps. All right, so another part that we want to look at is reviewing and updating documents, taking an inventory of and reviewing legal documents that are already in place and making any updates if necessary. When you look at the worksheet called Covering Care Costs, it'll help you with this as well. At the very least, make sure you have these documents in place, the durable power of attorney for both finances and healthcare, and a living will. Also, we want to give you a list of resources of professionals that you can reach out to. So you might want to save this image of this slide. There are several different legal professionals that can help, including the Elder Care Locator at eldercare.acl.gov, the National Elder Law Foundation, the Legal Services Corporation, the American Association of Elder Law Attorneys for all of your legal needs, and then resources for financial, like the Association of Financial Professionals, the Association of International Certified Professional Accountants. There's websites for each one of these as well. So just start by, maybe plug that website into your browser and go check it out and start putting it into your mind so that you can remember that you're not alone and you don't have to try to do all of this without a professional. You can get that resource and that guidance there as well. Okay, and our final note is to create a backup plan in case something happens to you and you're no longer able to fill the role that you're filling. So the next part of creating a backup plan includes kind of talking with other friends and family who could take over different responsibilities if you become unable to do those. This does include managing finances and the finances of the person living with the disease, but also your finances. So if just to remember if you're especially a close family member, you might have other separate things that are being impacted because you're caregiving. So maybe lining someone up who can be a backup for you for anything that might happen to you. Because as I mentioned, providing this care puts our own health at risk. And so we want to also put some more things in place for ourselves and just say, all right, I'm taking on a little bit more right now. Would you have my back in these ways as well? Consider assigning responsibilities to more than one person. If there's no other family members who are willing or able to help with these responsibilities, work on creating a plan with the person that you're caring for and possibly an attorney. If you're the agent for the person's power of attorney, meaning you're the one who will make legal, financial, and medical decisions on their behalf, it's a good idea to designate a trusted backup agent in case something happens to you. So talk with the person you're caring for to determine who should carry out those responsibilities. And then keeping an up-to-date list of their medical information is really important. You might have it all stored up here, but if you keep a binder, I really recommend putting all of this in a binder with everything from the tools that we gave you and any other documents that are important. And also include their medical information, any medications, any names and contact information of doctors and providers that are involved in their care. Just keep all of that right there because it's all a resource that needs to be managed to make sure that their finances are managed well as their care. And just to kind of remind you one more time, take care of your health. So as a caregiver, really the best thing you can do for them is to take care of you. So stay physically and emotionally strong, exercise, access therapy if that's available to you, get your medical appointments in, make eating well and staying physically active a priority. And then really looking also to other resources like respite care and other supportive services, like a caregiver support group. Maybe start taking an inventory of how you can take advantage of more resources to support this job that you're doing. And it is such an important and amazing thing that you're doing. And thank you so much for being willing to care for someone in this way. And also, if this is you and you're living with this disease, thank you for being open and communicating because it really benefits those around you as well as yourself. So finally, just want to plug one more time the Alzheimer's Association helpline. It's available 24/7, and you can also look up some of these resources on our website. It's a lot of information on the website, so I do recommend calling because they can kind of guide you there to the right info. And again, if you're interested in more of this course, you can register through that link that Beth shared on the Managing Money course for the Alzheimer's Association. But I challenge you to set a goal to work on those worksheets that will help you make a plan of having the conversations that need to be had and start getting more mindful and more organized as you move forward here. So as we move forward I'll hand it back over to our hosts, but there's a list of local resources as well that can provide a lot of other support. They also have tools and great resources for this topic of managing finances when caring for someone with a chronic illness such as Alzheimer's disease or another dementia.
Great, thank you so much, Raven. So much information to be shared, and there could be lots of things that you felt like you wish you could have written down, or lots of things that went through the chat. We have a record of every link and post, and so you're welcome to reach out to our group here through the webinar training. You'll also be receiving a recording of the training, so you'll be able to watch it again and hit pause and listen back to anything that you missed. As well as we keep things recorded and saved on our YouTube website. So this will be available to you. Even if you missed the email, you'll be able to find it on YouTube. So just as a quick reminder, if you don't mind advancing to the next slide, Raven. We do have a QR code that our attendees can fill out. This is really helpful for us as part of our funding mechanism. We're expected to report back on the number of attendees and the feedback from the presentation. This also helps us decide on future topics. We will be providing, after this initial 12 sessions are done, we'll have another 6 sessions that we'll be offering over the next year. So we'd love to have you help shape the content of all of that. And then if you could advance to the next slide again. So this is the remainder of our presentations. We just have one more with this series, which is collaborating across health and services. And as I mentioned, there'll be 6 more that will be offered every other month once these sessions have ended. So we will keep you in our listserv and send out information on those upcoming webinars. And also next, if you want to advance. The other piece of our program is, I'm sorry, go back just to the other part of that slide. The other piece of our program is our ambassador training. And this is where people throughout the state of Utah that are interested, not necessarily in knowing every single thing about dementia, but knowing the resources and where to guide your friends and family and yourselves through the process. We will be doing our training. Originally, we said spring of 26. We're moving that to fall just because we have so much content we're trying to incorporate in this program. So you can join us by Zoom. We'll have 6 sessions where we're training you on the different resources available in our state. And then after that, we'll switch to an online self-guided format. And we welcome you all to let us know if you're interested in that. So if you want to go to the next slide, here's that information there. You can fill out the QR code. You can really simply, if there's just so much QR codes and information, you can email us for any of the information here, adrc@usu.edu. That will help us get you connected to what it is you're looking for. So information to sign up about the ambassador program, information about future webinars, and also all the links and resources and guides that we provided in this presentation. So as a final reminder, this is a program in partnership with the Alzheimer's Disease and Dementia Research Center, the Institute for Disability Research Policy and Practice, the Utah Department of Health and Human Services Adult and Aging Services Division, and of course, from our wonderful presenter and her organization, the Alzheimer's Association. We do have 5 minutes for questions, and we do have a panel here of experts. So anybody would like to put a question into the chat, we will be able to try to direct those as best we can. Oh, and then Heather mentioned, yes, the links will also be included with the recording. So that would be helpful as well. As we're waiting for questions to come in, thank you, Raven. That was great. There was a lot of information there, and I think helped touch on how big the topic is, right? It goes beyond just finances. It's also legal. It's also having listening sessions with people on difficult topics. There's so much that goes to this. So I think that for people looking for more, a great place to start is that activity guide that we shared and working through some of those hands-on activities. And then again, connecting with resources, which we can help connect you to the resources that you need. So far, we're getting some great comments. There is a question. Okay. Is there any kind of referral for legal offices with expertise in this area? Better than just guessing with a phone book. Yes, that's a great question. I'm going to direct this one to Christy.
I would suggest on the resource slide, the local resources slide, I have Utah Legal Services on there. That might be a good option for your first call. And Raven, we're seeing your notes. I don't know if, there we go. Yeah, it's this slide. So Utah Legal Services, it's just utahlegalservices.org. And they're a government agency. They will let you know if they're able to help you. And if they're not, they will be able to refer you to someone who can.
Yeah, I put that link in the chat, and I'm noticing that some of my links are not coming through as hyperlinks. They're just coming through as text. So you may need to copy and paste that link or the text into a web browser. But great question.
I'll also add for Utah Legal Services. If you're an older adult, you can get free legal advice and guidance, or if you're low income. So that information is on their website, but you can also call them and they'll tell you about that as well. So just an FYI, it's a great benefit.
Kate, what was that website again that you're directing them to?
Sorry, I had to mute. Kate and I are in the same room and it was giving that nice echo feedback. What did you say, Beth?
Just what was the website that Kate was just directing people to?
It's that UtahLegalServices.org.
Oh, that same one. Perfect. Okay.
Yes.
Yeah, free is always better.
And the Utah Legal Risk Detector above that, it's questions that you go in and answer, and it'll tell you if you're at risk, and you can select if you want that information to go to Utah Legal Services so they can help you with that, or if you just want that for your own information, it doesn't go anywhere, it's private. And then I know Raven mentioned Medicaid and Medicare and options like that. I always suggest starting with your area agency on aging, which is that top link, that daas.utah.gov/locations. You can click your county and it tells you who your local people are, and you want to ask for it's SHIP, SHIP. It's the State Health Insurance Program, and they will give you guidance on insurance matters. And it's something that's totally free for people that are eligible for Medicare or Medicaid.
Okay, thank you for the comments. Any other remaining questions? Because we have time for one more. There's a bunch of workbooks and other resources also pasted into the chat. And as we mentioned, we will share these with you with the email that you get. So with that being said, it looks like we have answered the questions. Thank you all so much for attending. Special thanks to Raven and the Alzheimer's Association for providing the workbook and the materials. And again, if you have questions about the content, don't get the email, or just want to connect with us about the Resource Ambassador Training Program, just even if you have questions about it, just email us, adrc@usu.edu, or feel free to use the QR code that leads you specific to the ambassador training sign up. So thanks all. Have a wonderful rest of your week.